This is Dr. David Allen, and I'm talking with Dr. Kirk Christie, a very distinguished psychiatrist. And we're realizing now, Dr. Christie, is that there are some behaviors which may not be acutely suicidal, but in the long term are suicidal.
Yes.
For example, a person who's got a lifestyle of drug use,
Yes.
a person who's have a lifestyle of being abused,
Yes.
or having high trauma, or taking high risk behavior. It may not be an acute suicidal
Yes.
act, but over time, it's a longitudinal suicidal process.
Yes.
You want to comment on that?
Yes, Dr. Allen, and I would just like to emphasize that 1 in 4 persons in our community would meet the diagnosis for a major and/or minor psychiatric disorder. 1 in 4 persons. We know from the epidemiology that approximately about 1 to 2% of our persons would be diagnosed with schizophrenia, which is a chronic psychotic disorder. And also, we also know from the global statistics on anxiety disorders that approximately 4% of your population would meet the diagnosis for an anxiety disorder. We also suspect that depression is hovering around 3% in terms of the prevalence, overall prevalence, 3%. And we know from the evidence that major depression and even substance use disorder are often misdiagnoses. Because if you're not, as clinicians, if you're not asking the questions regarding mood and also the use of substances, you may miss these diagnoses. So I suspect that there are many people who need our help. They are not presenting to the community counseling and assessment center, nor are they telling their primary medical doctors that they're having issues with mood and or drug addiction, and even if they're having interpersonal conflicts or they're having discord, family discord, marital discord, and relationship crisis, they're not even saying that to their primary care physicians who may only have a few minutes with them to do physical examination. So there are many persons who need our care whom we are not seeing. And so I think that a lot of people are being missed in terms of psychiatric disorders, and this is lending to a lot of the morbidity that we're seeing in our community. Of course, we have available resources in the community, which are our Community Counseling and Assessment Center here on New Providence. We have our Family Island physicians whom we consult. We have about 10 psychiatrists. We consult with physicians on family violence. So there is help available on the rural family islands. We're also dealing with stigma, discrimination. There's generally fear when persons have emotionally distressing symptoms. They're afraid to come in and seek the help that they need because they often feel that persons would judge them or put them down, or they may other people may perceive that they're weak of mind, or they just don't have the wherewithal or the intestinal fortitude to deal with the day-to-day stresses of life. So we're also dealing with certain barriers to treatment, which include stigma, discrimination, and also antagonism of staff. Sometimes persons go to the clinic or they present elsewhere to our outpatient services, and they may perceive that they're being talked down to, or they're not treated well or fairly. This can play a role in persons not being seen and diagnosed and receiving the help and treatment that they desperately need.
It's very important because the psyche of our people is very shy, and even when it comes to depression and suicide, they don't like to tell you exactly. You have to read between the lines.
Yes.
You have to listen very thoroughly. And that's why if you're one is a priest or a pastor, people who are just hidden or want to talk but they don't really talk, please note those persons. They're speaking to you without speaking to you.
Yes.
They speak through their gestures. I know in the past few weeks, I've been approached by a number of persons who knew people who committed suicide, and they said there was something they realized they should have done, but they didn't do it because the person wasn't forthcoming. Well, they're not going to be forthcoming. So if you feel concerned about somebody, really either you make the move or get somebody to make the move toward them, because not making that move could be a big difference to them as far as suicide is concerned.
Yes. Yes, I concur, Dr. Allen, and there are many instances where persons may appear to be in a rush if they want to talk to their family member. If you have a loved one who is experiencing suicidal ideas and suicidal thoughts, you're noticing subtle changes in that person's behavior. A once gregarious, enthusiastic person is now all of a sudden negative in their thinking. They're pessimistic about the future. They are now sullen and withdrawn. And also take note of a smiling depression, quote unquote, a smiling depression. There are persons who would appear to have it all together. So they would be smiling and very enthusiastic among their colleagues, their work colleagues, and also acquaintances. But when they go home to their spouse, they're sullen and withdrawn. There is also symptoms of depression, which could be persistent sadness throughout the day for days back to back, and also what is called the loss of interest and loss of enjoyment once derived from normally enjoyed activities. This is a person that really you need to take some time out and have a direct inquiry and listening to that person without passing judgment, empathic listening. So I concur with you.
The other point is, please pay attention to repeated calls. Just a few weeks ago, a very well-known person called. I think they called around 5 o'clock. And I could tell by the call something was going around, not going well. 7 o'clock, they called back again. And then about 8:30, as I was leaving the house, they called. And I said, look,
Yes.
let's get together. I met them at 9 o'clock. And sitting there, even though he had brought many people through the years to the family, literally a rescuer,
Yes.
he said, Doc, when I called during the night, I was sitting in front of my loaded gun.
Yes.
He has permission to carry a gun. So I was talking to you, but looking at the barrel of the gun.
Okay.
Now, I knew something was happening. That's why you have to go by your intuition.
Yes.
So even though I hung up, I stood close to the phone. And as soon as daybreak came, I said, we got to get together. Finally, in the office, he confessed around 9. He said, Doc, I was looking at this barrel of the gun the whole night as I was talking to you. And I said, well, what do you think? He said, Doc, I want to do it.
Yes.
But I wanted you to know without telling you. And so what happened, I arranged for him to meet me later that day at the family in East Street Gospel Chapel.
Yes.
And this is a true story. He met me there at 4 o'clock. And there was this lady from Andros. She was sharing how she had her first child when she was 14 years old.
Okay.
And how that she thought suicide, but her family put such a ring of love around her.
Yes.
First I heard the Andros ring of love,
Okay.
where the mother and sister said, look, yes, this is hard, but we have you.
Yes.
Well, the gentleman was there who was looking at the gun the whole night. He looked at her and says, Mummy. I said, Mummy? Yeah. Well, my mother had me when she was 14 years old.
Okay.
So he said,
Yes.
now I'm going to call you mother.
All right.
Did you follow that?
Yes.
They bonded in that family session. And since then, that woman, mother, has been taking care of this very powerful guy
Okay.
who wanted to kill himself.
Yes.
He's now doing well. Not because of me, but because of this lady who he calls mother intercepting
Yes.
his life and saying, I love you as my son.
Yes.
The other day, the family, she made this beautiful scarf.
Yes.
It was blue. It was beautiful. She said, that's your prayer scarf.
Yes.
When you put that on, remember you're covered by God's love and my love for you.
Yes.
So people helping
Yes.
people.
Yes. Yes. I believe the power of prayer, the power of persons, and so certainly the power of the group in terms of the process dynamic groups and even the community groups is very powerful. And those persons become your extended family once you are a participant of the group. And so this is something, what is called the social recapitulation of the family unit. But on a deeper level, that person was able to transcend their current issues and identify with someone whom they perceive as the biological mother she was able to help this person who was in grave need. And he had suicidal intent, he had a suicidal plan, but he had that support. And so did he ever have a moment of catharsis and maybe a silent
Absolutely.
catharsis?
I'm telling the full story.
Yeah,
The point I want to make is that lady, who he didn't know until the family that Wednesday at East Street Gospel Chapel
Yes,
became like a surrogate mother.
yes, that's very powerful.
And
Very powerful.
to this day, he would say, I'm alive because of her, not David Allen.
Yes,
So we have to realize you could be an instrument for the other instrument, the real healing instrument, to take over.
yes,
But it's all about people
yes.
helping people.
And on that note, the treatment for persons with suicidal behavior disorder is multifaceted. And so I would just like to iterate that we should not be fixated on the suicide rate at this present time, but it is important. And we need to follow the rate for this year over the next 12 months to see the year-end prevalence. Because I've seen a lot of sensationalizing of this absolute number. But the last research that we looked at, the suicide prevalence rate was 3 per 100,000 per capita of the Bahamian population. The worldwide population is about 11 completed suicides per 100,000 globally. And the group that completes suicide, according to the global statistics, is age 15 to 29 years. And suicide is the third leading cause of death in this group.
And I think what you said, Dr. Christie, is so important. This is not the time to panic. Don't let figures of abuse and suicide, even murder, make you panic. You stay on your guard. Monday night, I'm in Camp Road Ministries. Wednesday, I'm at East Street. Thursday, we have Grace Gospel Chapel. Friday, 12 o'clock, we're at Fox Hill. Friday, 5 o'clock, we're at St. Barnabas. Sunday, we have these family groups so constituted now that you just come. And if you need help, call me, 557-3172. They are miracles. They're now been placed. Now, I didn't know I was doing that by last October. I didn't know about the suicidal thing coming. But by placing them all through Nassau right now, I've got Nassau covered.
Yes.
People show up.
Yes.
When I go to Camp Road last Monday night, it was 5:45. A lady was there waiting for me.
Yes.
She said, Dr. Allen, I'm a prophetess. Well, you know, she's a very religious lady. And in my vision, I saw that my niece wants to kill herself, and I saw a knife. And before I came here, I went to her house. I saw the knife, and her niece said, why are you coming here, Auntie? She said, because I had a vision that you're going to kill yourself. Auntie, how do you know that?
Yes.
Because I saw it from the Lord.
Yes.
I said, Auntie, you're absolutely right. I'm pregnant. I don't want this child.
Yes.
And I've had this knife to kill myself.
Yes.
Isn't that interesting?
Yes.
So I said to Auntie, please bring her to the family.
Yes.
So last Monday night, I didn't know what I was going to Camp Road for, but we had the whole meeting around her.
Okay.
Wednesday we saw her in the office, and now she's back and doing well.
Okay.
It was that auntie who had the dream, making the contact,
Yes.
and that's it. People helping people. But you have to stay on your guard. Don't panic.
Yes.
Be on your guard. And really just keep loving. Love solves everything.
Absolutely.
St. John of the Cross, where there's no love, put love,
Yes.
and you receive love. So this time in the Bahamas, family, fellow citizens, please don't panic. Just keep on loving. Look at your home, look at your neighbor, look at your choice.
Yes.
Speak to people, hello. If you're worried, call somebody. If you're really worried, come and bring them to the family group.
Yes.
Really warm. And I can tell you how Bahamians are very warm. They're beautiful people, you know.
Yes.
They're
Yes.
very loving. When a Bahamian's in trouble, other Bahamians know how to get around them and support them. I've seen that so beautifully. Unlike working in the States, that doesn't happen. But here, it happens
Yes.
fantastically.
I do agree, Dr. Allen, and I think it's very important that families communicate on a better level. And so it's very important to sit down with your children, have a heart-to-heart talk during the week. Also, if you're married or in a committed relationship, talk with your spouse, talk with your significant other, ask them what's going on, have a direct inquiry about their mood, how are things going on with your emotions. Are you having any negative thoughts? So I think we need to really be more communicative in our country and put down the phones, especially during family time or dinner time. put the phones away and be more communicative with your family.
Now, Dr. Christie, you're an expert on the drug problem in our country as well. Is there any connection between the widespread use of alcohol, marijuana, cocaine, mental illness, all coming together as one, causing this phenomenon in our midst of suicide?
Yes, Dr. Allen, it is a confluence of factors. And so we know that having undiagnosed depression is a risk factor for completed suicide, especially in cases of severe symptoms or severe depression, where persons may be experiencing something called nihilistic delusions, where they have extreme negativism, they have a pessimism about the future, they may have some thoughts, suicidal ideas, suicidal intent, where there's a strong commitment to complete suicide, and also they may be formulating a suicide plan. Certainly, if those persons now drink alcohol as a way of escaping those negative thoughts, pessimistic thoughts, and even suicidal thoughts, we know that alcohol binging can lead to worsening depression symptoms. And alcohol or ethanol is a depressant. So it acts on the brain to bring on more depression.
So the
and to lower
depression
the
plus
serotonin.
alcohol. What about marijuana?
Marijuana is a stimulant, but certainly it causes intoxication. So
What about the more powerful type of marijuana? What's hyperponic?
hydroponic, more THC content in terms of approximately 15 to 25%
Could that be
THC
adding
concentration.
to our problem as well?
Well, marijuana it's a stimulant, but then it causes intoxication, and certainly persons now their judgment may be impaired if they're under the influence of both alcohol and marijuana, and also a nicotine product such as the Black and Mild cigar or
Sorry,
grabber.
Black and Mild?
Yeah. The delivery methods include tobacco products such as Black and Mild.
But why is that so more important than cigarettes or
persons,
vaping?
they take out the filling and they replace marijuana, the tobacco filling, and they put
so
the
they put the marijuana in the Black and Mild.
Yeah, and so there's a combination of now a tobacco product, which is a stimulant, and it is high in nicotine content, and so these drugs can impair your judgment. So your overall judgment may be impaired, and so you don't make very good decisions being under the influence of multiple drugs. But we know that alcohol is a depressant, so alcohol binging, that's having episodes of drinking more than 4 standard drinks at one sitting, and if that continues with undiagnosed depression, it can lead to completed suicide. We suspect that some of our motor vehicle accidents, which result in fatality, may be as a result of completed suicide, and also could be as a result of persons under the influence of substances with suicidal ideations. And
now that's very serious.
Yeah, death by motor vehicle accidents.
Are you saying, Dr. Christie, because we've had a lot of traffic accidents.
Over the last 10 years, we've had a lot of
So
fatalities.
you're saying some of those accidents, those bodies should be really examined properly because they could be persons who are dying from substances, but also maybe also suicidal?
Yes, I do agree with you, Dr. Allen. And your task force on suicide did recommend for the return of the psychological autopsy. And so I would encourage the Royal Bahamas Police Force to engage mental health professionals to complete the psychological autopsies when we see death by motor vehicle accidents, and also in cases of suicide. The psychological autopsy allows us to recreate the events prior to the demise of the suicide victim. So we're able to interview family members, whether it be immediate family relatives, colleagues of the individual, and also extended family about the person's mental state prior to their demise. Wow. It's very important for us to gain some insights into the state of mind of that person prior to their demise.
Dr. Christie, I thank you for the great work you do because that insight is so important. Hey?
Yes.
An accident may not be an accident.
Yes.
It could be a suicide. Well, we're going to take a break and be right back.